Hey, what's up, everyone? So, opting in for a major surgery, it isn't easy, especially one that is promoted to bestow life-changing results. And in the haze of doctors' advice, concerns from friends, and ridicule from parents, one wonders what's what with bariatric surgery. First, bariatric surgery is an umbrella term for weight loss procedures like gastric bypass, gastric sleeve, and adjustable gastric band. The idea of it is to restrict the volume of our stomachs and to inhibit weight loss through surgical interventions like wrapping a band around our stomachs, stapling them, or rerouting our intestines. In the end, we should feel fuller sooner, thus resulting in less calories eaten and more weight loss. Now, if we zoom out and wonder how long surgeries like these have been around, we see that no one in the 1500s, 1800s, or even early 1900s ever heard of any intervention of this kind. Not until 1954, less than 100 years ago, when Dr. Kremen and his team performed the first gastric bypass surgery. And from the first surgery to today, 250,000 of Americans will undergo bariatric surgery annually, with an estimated 20 or more million people qualifying to get the surgery if they want. Now, this leads us to the big question: should we do it? But before that can be fully answered, a glance at the risks involved is necessary. First, as mentioned above, there are multiple types of bariatric surgeries, but in general, the mortality rate is less than 1%. And for most surgeries, the complications post-op typically affect between 10 to 25% of patients, which isn't great. The complications can vary widely from band erosion, GERD, infection, chronic nausea, and chronic vomiting, to name a few. Again, though, the majority of people don't experience these complications. Now, the promoted success rate is what makes bariatric surgery so alluring. However, the failure rate is a point of contention, with it being anywhere from 5 to 35% when followed up after a few years. And some data reports that after 10 years, there's a 70% failure rate. Still, of course, that is all highly contested and debated, despite how straightforward it may seem. But, those are the risks involved. So what's the reward? Well, doctors don't consider bariatric surgery a success unless the patient loses at least 50% of their excess body weight. And Jessica Smith, a bariatric surgeon, states patients may lose 30 to 50% of their excess weight in the first 6 months, and 77% of the excess weight as early as 12 months after surgery. Now, Dr. Smith's statements bears out to be accurate when we look at the data, showing that overall, yes, bariatric surgery will help people lose weight. And after all of that, bariatric surgery seems to be very beneficial for severely obese people, and the risk of death or serious ailments seems to be relatively low, especially when contrasting it with what transpires after living additional years as obese. And I'm not here to tell you what to do, but these are some quick facts around bariatric surgery that may help you make a more informed decision on what you should be doing. Now, I have links to studies down below. Thank you for coming by. I appreciate it, and good luck.